Welcome to Breakfast with Spaniels with Dr. Judy Morgan.
Dinner, breakfast, snack, I don't know. But we're here.
Remember, you can purchase all of Dr. Morgan's products at her website at www.drjudymorgan.com. Now it's time to sit back, relax, and enjoy the show.
And get the music turned off. Well, hi, everybody. Sorry I didn't get on this morning. We've been busy. It's like a little crazy. Poor Nanny, we've got her working her butt off again today, unpacking more stuff, getting stuff on shelves, getting organized. And we had a powwow with the staff this morning, trying to figure out our plan of attack for everything that we have going on. Oh, are you?
Will this Face ID you?
You want me to Instagram?
Yeah.
There you go. Sorry, I didn't set up the Instagram phone. Anyway, all right.
Is that your face?
Yeah. Oh.
Oh.
Okay, now we have dogs going crazy, and there we go. All right, so, hi, Instagram. Gwen got me set up. Oh, well. Anyway, it is, I just learned this morning, it is Diabetes Awareness Month, and that's probably for people more than for animals, but what the heck, it applies to all of us. And I think it's something that we need to talk more about because it is a very common disease in both dogs and cats as well as people. And dogs and cats tend to be more like human type 2 diabetics rather than type 1, which is something that you have as a child. Most adults that have diabetes have type 2 diabetes, which basically means your pancreas kind of got worn out. And that's what we see more commonly in our animals. It is very rare. I think in my entire career, I only had a handful, like literally less than this many, juvenile diabetic patients that developed it very early in life. It's just not very common. But we do see a ton of diabetes in middle-aged to older dogs and cats. And there's a couple of things that are predictors of that for us. And interestingly, when you look at studies, particularly studies that are performed by large pet food companies, they are very quick to say that foods that are high in carbohydrates do not contribute to diabetes. I disagree. They are very quick to say that foods high in carbohydrates do not lead to obesity. I disagree. Because particularly for cats, they are obligate carnivores. They have no use for all the carbohydrates that are found in the kibble products that are fed to them. And frankly, AFCO and NRC, which are the groups who decide what nutrients are required in our pets' diets, they have no requirements for carbohydrates for dogs either. Even though they are not obligate carnivores like cats, they do not have a carbohydrate requirement. And so they don't do as good a job of breaking down the carbohydrates and utilizing them appropriately as they do with proteins and fats, which is more what they're meant to be eating. And because of that, they tend to sort of store all of that extra and the carbohydrates break down to sugars, basically, their bodies don't utilize that very well, and they tend to be more obese. So animals that are going to be more prone to developing diabetes are going to be obese animals and animals that are fed high carbohydrate diets. For our kitty cats in particular, it's particularly those who are fed dry kibble with a lot of carbohydrates. It's sort of like what we would see if we were eating candy bars all day long. Because what happens, they take in that high carbohydrate meal, and then their pancreas has to spit out a lot of enzymes, and it has to spit out, because the carbs are breaking down to sugars, the pancreas does an insulin dump. So when you eat all those carbs, blood sugar goes up. The pancreas spits out a bunch of insulin, and the blood sugar drops back down. And then the cat says, wow, I'm feeling kind of hungry. I think I need to go get more. And so they eat more carbs, blood sugar goes up, insulin spits out, down it comes again. And frankly, over time, the pancreas kind of wears out. It's like, I can only do that for so long. And one of the reasons that we see problems with obesity contributing to diabetes is that, one, the body is being subjected to a lot of inflammatory hormones that are actually released by fat. And so in those obese animals, we more commonly see bouts of pancreatitis. I think we just had a discussion about this in one of our holistic vet groups, that simmering chronic pancreatitis is much more common than what we diagnose. And when the pancreas is in a constant state of inflammation, there's pancreatic cells that are being killed off. After a while, it's not producing the insulin, or we get insulin resistance from obesity. And we'll discuss that more in our summit this weekend. We actually are going to discuss this in one of our topics. We're going to discuss obesity and insulin resistance and how diet plays into that. But the takeaway that everyone really needs to understand is that keeping your pet on a species-appropriate diet, which means that they're going to be eating meat and non-starchy vegetables and healthy fats, keeping their weight where it needs to be so that we decrease inflammation in the body, we decrease the work on the pancreas. Those are the most important factors. Two things that you can control: not feeding a lot of carbohydrates and keeping the weight at a healthy weight will decrease the chances of your pet developing diabetes many, many, many times over. And frankly, you don't want your pet to develop diabetes, because the oral tablets that we take for type 2 diabetes in people really don't work well in animals. And almost always, animals that develop diabetes will require 2 insulin injections a day, which means your entire life is now going to revolve around being available to give your pet 2 injections a day, and they need to be every 12 hours. So it can't be like, well, we went out to dinner, we got home a few hours late, and yeah, you've got to keep their blood sugar in a steady state. So when we have done blood sugar testing on animals that are fed a raw diet or a gently cooked species appropriate diet, their blood sugar tends to run in the 70 to 100 range. Animals who are fed a high carbohydrate diet, their blood sugar is going to stay more in the 110 to 140 range. So you can see there's just a huge difference in what the body is being subjected to just based on what is being fed every day. So that's your tip for the week. Keep your pets at an appropriate weight and feed them a species-appropriate diet. It's just one more way to help prevent some of the chronic diseases and chronic inflammation that we see. Okay, I'll see if I can get us a little music. I got a meeting in a few minutes. Come on. Here we go. Everybody have a wonderful afternoon. What's today? Tuesday. Should be on in the morning tomorrow. I don't know. It's a kind of catch as catch can these days. Everybody have a great day. Oh, I don't know how to do this one. Glenn hasn't told me how to make it end.